Alcohol addiction. Alcohol addiction occurs when a person becomes dependent on alcoholic beverages to the point of being unable to control their consumption, despite being aware of the negative consequences. Examples include drinking daily, hiding bottles, getting drunk at work, or being unable to sleep without alcohol. The harmful effects include liver damage, cognitive decline, depression, suicide, domestic violence, and traffic accidents. Long-term effects may lead to alcohol use disorder, AUD, which can be fatal if untreated. Nicotine addiction. Nicotine addiction involves dependence on nicotine found in cigarettes and vapes, leading to constant cravings. Examples include smoking immediately after waking up, becoming irritable without cigarettes, or excessively vaping while working. Negative effects include lung, throat, and mouth cancer, as well as heart disease and stroke. Long-term nicotine is highly addictive, and even vapes, often perceived as safer, contain high nicotine levels, making quitting difficult. Caffeine addiction. Caffeine addiction is dependence on the mild stimulant found in coffee, tea, soda, and energy drinks. Symptoms include headaches, fatigue, or mood swings when caffeine is skipped, or consuming excessive amounts, e.g. 7 cups a day. Side effects include anxiety, heart palpitations, insomnia, and psychological dependence for focus or mood regulation. Long-term, while not deadly, it can disrupt sleep, heart health, and brain function. Sleeping pill addiction. This addiction involves dependence on sedatives like diazepam, alprazolam, or lorazepam. Examples include needing pills nightly to sleep, panicking when running out, or self-increasing doses due to reduced effects. Risks include memory impairment, daytime drowsiness, physical psychological dependence, and overdose. Long-term withdrawal can cause severe symptoms like seizures, extreme panic, or hallucinations. Opioid addiction. Opioid addiction is a heavy dependence on powerful painkillers, including illegal heroin and prescription drugs. Users may start with pain medication, escalate use for euphoria, and eventually turn to heroin or fentanyl. Dangers include euphoria followed by tolerance, overdose, and severe withdrawal symptoms. Sudden deaths are common due to respiratory depression. Amphetamine addiction. Amphetamine addiction involves dependence on strong stimulants like meth, Sabu, used for energy, euphoria, or productivity. Examples include using meth to stay awake for work, or experiencing extreme confidence followed by paranoia. Effects include permanent brain damage, aggression, meth mouth, rotting teeth, and intense addiction. Long-term, it may trigger psychosis, e.g. schizophrenia, and requires intensive rehab due to high relapse rates. Cocaine addiction. Cocaine addiction stems from the potent stimulant derived from coca plants, causing rapid euphoria and energy. Users often take repeated doses for parties or sexual performance. Risks include heart attacks, extreme paranoia, nasal damage, if snorted, and severe psychological dependence. Long-term, a cocaine crash leads to deep depression, suicidal tendencies, or loss of self-control. Cannabis addiction. Cannabis contains THC, a psychoactive compound causing relaxation or a high. While often seen as harmless, it can be addictive. Examples include daily use, insomnia, or anxiety without it. Negative effects include impaired concentration, motivation loss, anxiety disorders, and psychosis. Long-term use may lower IQ, especially if started in adolescence, and harm social career development. LSD addiction. LSD is a hallucinogen altering perception, time, and consciousness. While not physically addictive, users may crave the experience. Examples include seeking repeated spiritual trips or experiencing flashbacks. Risks include severe hallucinations, reality distortion, and sudden flashbacks. Long-term, some users face permanent personality changes or detachment from reality. Inhalant addiction. Inhalant addiction involves inhaling household chemicals, e.g. glue, for a quick high, common among impoverished youth. Examples include street children sniffing glue daily. Effects include brain nervous system damage, unconsciousness, or sudden death. Long-term, irreversible brain damage may lead to paralysis, speech disorders, or death. Anabolic steroid addiction. This addiction involves synthetic hormones, like testosterone, used to build muscle rapidly, often by bodybuilders or athletes. Examples include continuous steroid injections despite knowing the risks. Side effects include severe acne, hair loss, liver, heart damage, impotence in men, and emotional instability. Long-term, it may cause permanent infertility, severe depression, or suicide post-cycle. Cough syrup addiction. Addiction to cough syrup involves overusing over-the-counter medications containing dextromethorphan, DXM, for hallucinations. Examples include teens drinking multiple bottles to get high. Risks include hallucinations, disorientation, heart-liver damage, and overdose, especially if combined with acetaminophen. Long-term, it damages the brain organs and may progress to severe, unnoticed dependence. Synthetic drug addiction. Synthetic drugs are lab-made compounds mimicking cocaine, cannabis, or amphetamines, but often stronger and unpredictable. Examples include spice users hallucinating or attacking others, zombie-like behavior. Risks include paranoia, extreme aggression, heart attacks, seizures, and high death rates due to inconsistent potency. Long-term, even minimal use can cause permanent brain damage. Nitrous oxide addiction. Nitrous oxide, laughing gas, is an anesthetic gas misused for euphoria. Examples include inhaling dozens of balloons at parties. Risks include unconsciousness, falls, nerve damage, or death from oxygen deprivation. Long-term chronic use may damage the spinal cord, causing paralysis. Painkiller addiction. This addiction involves overusing over-the-counter pain relievers, e.g., ibuprofen, paracetamol, for minor aches. Examples include taking 6 to 10 tablets daily for mild headaches. Risks include liver damage from paracetamol, stomach ulcers, kidney failure, and rebound pain. Long-term, it may cause permanent organ damage and psychological dependence. Barbiturate addiction. Barbiturates are outdated sedatives for insomnia seizures, now rarely used due to high addictiveness. Examples include escalating doses for sleep, leading to unconscious dependence. Risks include slowed breathing, coma from overdose, and severe physical addiction. Antidepressant dependence. Some antidepressants, e.g., SNRIs, tricyclics, may cause psychological dependence or withdrawal. Examples include users fearing to stop even after recovery. Side effects include flu-like symptoms, dizziness, and mood swings when quitting. Long-term unsupervised use may cause emotional imbalance and difficulty stopping. Antihistamine addiction. Overusing allergy medications, e.g., diphenhydramine, for sedation, hallucinations. Examples include teens taking 10 to 15 pills to escape reality. Risks include hallucinations, rapid heartbeat, confusion, seizures, or death. Long-term, it may cause memory loss or psychosis. Topical painkiller addiction dependence on pain relief creams, e.g. menthol, capsaicin. Examples include daily use for minor pain, with anxiety when unavailable. Risks include skin irritation, rebound pain, and placebo reliance. Long-term, it may create unconscious psychological dependence. Diet pill addiction, stimulant-based appetite suppressants, e.g. phentermine, are misused for weight loss. Examples include prolonged use after reaching normal weight. Side effects include heart palpitations, insomnia, eating disorders, and extreme anxiety. Long-term, it may damage metabolism and body image, leading to post-use depression. Smart drug addiction misuse of focus-enhancing drugs, e.g. Ritalin for ADHD for productivity. Examples include students using them daily during exams, leading to addiction. Risks include heart issues, insomnia, nerve tension, and psychological dependence. Long-term, it may harm the nervous system, cause mood swings, or lead to burnout.